Hello, everyone, and
Wait,
thank you for, what?
Oh, 1 second.
Let me know when to go.
Hello, can you hear me?
Steve, hi.
Hi.
Yes, we can hear you.
Okay.
We're ready.
Okay, we're on Facebook?
Mm-hmm.
All right, great. All right, thank you, everyone. Hello, and thank you for joining us tonight. My name is Kayla Greco, and I am with United Activities Unlimited, or UAU Census Initiative. With everything going on in the world right now, particularly with the last few months having been a pandemic, we know that the 2020 census has not exactly been at the top of everyone's list of priorities. But the truth is that COVID-19 has actually made getting an accurate count in the census more important than ever. Over the next hour, my colleagues Matt, Nicole, and I will be sharing with you how an accurate count in the 2020 census is crucial when planning for and providing logistics, support, and supplies to emergency planners and first responders, especially during times of crisis. We will also be speaking with several experts and professionals in those fields. Tatiana, you have to screen sharing for me. But saying I can't share my screen. Sorry about that. Sorry, this is COVID-19 life, right? Everyone's working from home at technical. Okay, so once again, we will be speaking with experts and professionals in the field of emergency planning and first response. Those experts and professionals will be Lisa Orloff from the Rural Care Center, Steve Lawton from Communication Workers Union, Christine Holly from Northwell Health, Ahmed Butte from Asian American Federation, Isenia Mata from La Colmena, Lindsay Einhorn from New York City Emergency Management, and at the end we will have a special message from our Congressman Max Rose. So now without further ado, I'd like to ask you all to ponder a question that you might not have thought about until now. In an emergency response situation, how do you think organizations like FEMA tailor their efforts? How do they know where to go, what to do, and who needs the most help? The answer, it might surprise you to know, is census data. George Glazner, Deputy Coordinator of Emergency Management at Newport, said, without Census Bureau data, it would be impossible to predict who we need to help. So now just a little overview of the census before we get into that. The census is a complete count of everyone living in the United States. It happens every 10 years. So the last one was in 2010, this one's 2020, and we won't get another chance to do it until 2030. So those 10 years are crucial in the fact that we want to get this right this time. It's very simple. It's only 10 questions, basic demographics about everybody who lives in the household. And that's, for the first time, it's actually online. So you could take 10 minutes and do that online. We're actually going to be sharing the link in the chat on Facebook several times tonight if you haven't done it already. And those 10 questions of the 2020 census will dictate $675 billion in federal funds distributed annually for the next 10 years. And like I said, that info is also used in emergency response. But what information? What do first responders need to know? One of the first things we can learn from Census Bureau data is the primary language spoken in the area. For example, it was found that in one town in Texas, found that 86% of those residents spoke Spanish. And that's obviously very crucial for emergency management to know so they can properly deploy Spanish speakers in areas. And just to bring it home, we know that on Staten Island, at least 35% of us speak Spanish. So because we're part of New York City and we're part of a melting pot, there's a lot more than just Spanish that we need to know about. On Staten Island alone, we have Russian, Italian, Chinese, Arabic, Polish, Korean, Tagalog, Urdu, and even some less common African languages, all spoken in Staten Island. And even if only 0.5% of the population spoke the language, that's still several thousand people that we need to worry about. So it's important that those people are heard and that emergency responders know where to allocate those language resources. Another piece of information that emergency responders would know would be about our map information. The Census Bureau takes our data and uses it to create maps to identify distribution points for supplies, know where wheelchair accessible materials need to go, and set up shop for shelters in a crisis situation. And this is, again, bringing it home for Staten Island. It's important because our island is prone to flooding. You can see on these colored areas here, these are our flood zones. So it's important to know that in the census data for emergency response. And one of the ways that the Census Bureau does this is that it actually creates tools for emergency responders to know using the data from the Census Bureau. One of these tools is called On the Map. The actual link is right here, so you can go in and check it out anytime. It's a quick snapshot of the entire country and showing live situations going on. And you can actually go in and click on any area in a crisis at the time and have a breakdown of whatever kind of information you feel like you need to know. And this is especially useful for FB and Wire and NYPD. They would go in and break it down by whatever demographic or anything they needed to know at the time and use that to properly allocate resources. This is just one thing that Census Bureau data does for emergency response. Another piece of information is our age demographic. So knowing the ages of any residents in an area can help dictate where our vulnerable populations are. The vulnerable populations could be anybody under 18 or children, or anyone over 65, or so seniors. And this is especially important now because our over 65 estimate will help dictate how many ventilators are needed in our current COVID-19 pandemic. And obviously the big one that the Census Bureau helps us know is our population count. The biggest thing that anyone would want to know in a crisis situation is how many people do we need to save? And these numbers right here are population estimates, but they're old data. So we need everyone to go to my2020census.gov and fill out the current 2020 census so we get accurate, updated population for our island. So the bottom line is that in order to reduce the risk in any sort of emergency situation, the best way to do that is by knowing our community. And now I'm going to turn it over to my colleague Matt, who will be talking about a specific situation that hit Staten Island back in 2012, and that was Superstorm Sandy. He'll be sharing with you how census data was used in those recovery efforts.
Hey, so good evening, everyone. As Kayla said, my name is Matt, and I'll be talking to you a little bit more about the census and crisis, but I'm going to bring it home to a little bit to something that we all know about, which was Superstorm Sandy, and how the census data itself was used in terms of its recovery efforts, and what we know about it now, and what we can use to plan ahead for something like a Sandy. So for those of you that don't remember, in October of 2012, Sandy did ravage the entire eastern coast of the US, hitting New York City and particularly Staten Island very hard, both in terms of economic damage and cost, of course, in human casualties. So according to NOAA, Sandy cost New York over $74.1 billion in damages. This was actually the costliest disaster in the state. And initial reports show that there were about 53 lives lost in New York City, 24 of those being from Staten Island itself. So this is something, and as you can see, a picture can definitely tell us a picture is worth 1,000 words. We have Great Falls Marina on the right before hit, and then after Superstorm Sandy hit, and therefore we can see the devastation that this storm really caused. So we want to know a little bit more about how the census efforts were used in the campaign, right? So census data is used for emergency planning and disaster situations, as Kayla has said previously. But for something like Sandy, FEMA and local officials and the city use it to plan for the upcoming storm and also to deal with the aftermath of the storm itself. Much of the data that is used within the census is the risk regions and the risk populations, vulnerable populations. But how exactly does the census do that? In what ways is that data utilized so we can accurately prepare and accurately deal with some aftermath? Well, I think an example might be the best way to kind of do that and explain that. So this is a map of Staten Island with the entire eastern shore of the island highlighted in blue. They're actually the highlighted census tracts, or just another fancy word for neighborhood. And this is an area, as Kayla had shown previously, which is particularly flooding. This area was particularly vulnerable to something like Sandy. So we're going to do like a little bit of a case study and use this census that we've had in the past to prepare and think about how we would operate if we were emergency responders. Think about this type of stuff. So according to the 2010 census, about 66,000 people live here. So that's actually a lot of Staten Islanders. That's 1 out of every 7 Staten Islanders living in this flood-prone region. So if we were those emergency responders and we wanted to think about how can we adequately prepare so we can protect the area and protect the lives that are living in this area, what are some questions that we would really need to be answered? So the first one we actually have answered, but the first one would be, how many people live here? How many households are there in this area? What types of households are there? Are they semi-attached? Are they apartment buildings? Are they older? When are they built? We need to know this type of thing. How many people live in each household? What is the population density of certain regions, specifically the highlighted regions? Where are the evacuation centers for these residents to flee should become necessary? And of course, how many people are within these vulnerable populations, meaning our children or senior citizens? We got the first answer, right? You said there were about 66,000 people. We can look further into the census data, and that's what we as emergency responders or emergency preparedness workers would do. We would look at this area and say, well, if in the selected population, again, there's about 66,000 people, we have about 22% of them being under 18 years old, and about 12% of them being over 65. So these are considered our vulnerable population. And together, they make up about 34%, 1 out of every 3 people living in this area. That is something we need to take into account when we're adequately preparing for this type of disaster coming our way. So we can actually go even a little bit further if we need to, because we can highlight in this region, you can see that of the 8,000 people, or about the percentage that the 22% that was living there, right? Of that population, about 24% of them are living alone. So this causes even more of a vulnerable population for these people, since they may not be able to leave as quickly as some people who are living with others, some elderly who are living with other people. And that may seem like a small percentage of a percentage of a percentage. We are talking about 2,000 elderly people who may not be able to simply pack up and leave their household in the event of disaster. So this is something that we really want to make sure that we understand in terms of our emergency response. But there is something in particular that we didn't really think about, and of course it is what if our initial numbers were wrong? So the numbers that I gave you are from the 2020 census. What happens if not everyone responded? So we may not know the accurate count of people living here. From our last census, from the 2010 census, it was estimated that only about 69% of New Yorkers were there. And if we just say apply that 69% to this region, then of the 66,000 people that are living there, that means we didn't get responses from about 20,000 people. So that 20,000 people were not accounted for, and our first responders were essentially left to other possibly inaccurate means to account for these people. And guessing, especially in terms of emergency preparedness, is not the thing that we want to do. So we really need to know, what can we do in this situation? Well, of course, we can fill out our census to make sure that we count and have an accurate count of the people of our population, of our community. We can help out our first responders. Because how are we supposed to help all of the residents? We don't even know how many there are. And you can also ask, well, why can't we estimate? Estimating does come with some problems too. In fact, we can underestimate, but that would include the risk of overcrowding these centers, having insufficient amount of supplies, and many, many issues in which we don't have enough of the supplies or the resources that we need. Overestimating also comes with these little issues as well, because we don't have an unlimited supply of these things, whether they be in emergency responses, blankets, water, medical tests, anything in something like a Sandy type situation. We could be taking money or those resources away from other people if we overestimate for a certain region. So this is something that is a big problem with the census data, and it's imperative that by filling out your census, you are able to tell the emergency responders that you are here, and should the event occur, these are the people who need help. And to actually streamline that a little bit more now, we're going to have a little bit of a Q&A session with our first two guest speakers of the night. So the first speaker is going to be Lisa Orloff from World Cares Foundation, the founder. Then we have Steve Lawton, the president of the local chapter of the American Communication Workers of America. I'm going to stop sharing my screen right now and bring them on. So let me just go ahead and do that. I believe I have Lisa here right now. I believe I also have Steve here. Yes.
I'm here.
Okay. Have a. You there? I hear Steve sounding off. You good? Lisa, you good?
Yeah, I believe so. Can you hear me all right?
Yes, we absolutely can. Thank you both for joining me. We very much appreciate you being here with us. So I guess just the first thing I want to talk to you guys about is simply just a little bit about your roles. So tell me a little bit about what you do, your roles, and how the census is related to it or how it is important. So whoever wants to sound off first, you can go.
Steve?
I yield to you, Lisa. Go ahead.
All right. So World Care Center is a nonprofit organization that was founded post 9/11 by citizen volunteers who came out to help during the disaster relief effort, and found that they were able to assist in many ways. However, they lacked specific disaster response training. And this in part led to a lot of people being exposed to hazards, getting sick, both physically and mentally. So over the course of almost 20 years, we have developed and evolved, and we focus predominantly on training individuals to emerge as educated disaster volunteers and local leaders to know how to step from community activist or community organizer and add on to those skills to become disaster managers. And so we were very active on Staten Island during the Superstorm Sandy relief effort. Michelle Bascom and Lindsay Einhorn, who are on the call, or Michelle, who works for the organization, and Lindsay, who's on the call, were part of World Center's team effort, running volunteer reception centers during Superstorm Sandy. So training, safety training, and the provision of personal protective equipment is extremely important. When in our backyard, we'll step up and we'll actually manage spontaneous volunteers and local volunteers to do relief effort.
Incredible work. Thank you. Steve.
Yeah, so, I'm president of the Communication Workers of America, Local 1102 here on Staten Island. We have 500 members. Half of the local works for the company Verizon. The other half works for a company that actually administers, in a call center, administers the Easy Pass system here in Staten Island, for all New York. So our experience with disaster, we have a couple different experiences there. One is that as a labor union, we have to deal with disasters in terms of how we support our workers. So, in Sandy, for example, we had a real concern to make everyone safe and to make sure that they were working safe. And we had to, our garage, one of the shops was down on Bay Street and actually had gotten, the water came up and over so we were like moving equipment and getting everyone safe. Here during COVID, another disaster, we're dealing with getting people out of the call center, working from home. So that's one way that we deal with disaster. Another way is that our local is very involved in our community, and we do a lot of volunteer work. And we try to support all sorts of community work that goes on. So, that's another way that we would be supporting. When we talk about Sandy, I just want to bring this point up.
Yeah.
One of the main roles that our members played right in the aftermath was to bring telecommunications back to the areas that were impacted. And the workers took that as part of their mission at that point. So, and it was a very important mission to bring communications to the places when they lose them after a disaster. Yeah.
Of course. Yeah, that actually brings me to one of the first questions I had for you, which was specifically on communications. So, in terms of an accurate count of the population living in that area, can you just kind of explain a little bit as to why that's a crucial piece of information in terms of re-upping communications and resolving those issues from like a superstar?
So telecommunication companies that I happen to know this experience use census data to build their networks. So like when they're just planning out like how many people are in this neighborhood, how big of a cable shall we run down there, they need to know the census data, right? Because then it tells them a roundabout way to plan out their business. So that's basically it. And when a disaster happens and there's a lack of communication, we have to figure out, how many people are out of service and how do we bring them service back up and where should we focus in first and where should we, and things like that. So it's important to the telecommunication system.
Yeah, awesome. Actually, Lisa, I'm going to flip to you if that's cool. I'm just wondering a little bit more about some of the data and the demographic information which emergency responders can use. So some things that your team might use that's directly from the census data that you're using to help save these people, save communities in times of crisis.
Sure. So Matt, we do a lot before. 80% of what we do is before disaster strikes. So we're using the census data in all of our planning. We're looking for what is referred to as opportunity zones, where those are areas where there aren't as many resources, where we really need to go in and focus on the community and empower them to take care of themselves because they may not have the resources that other neighborhoods have. You had mentioned before where seniors live or where the very young live, or maybe where there are certain types of special needs buildings, or and that's where we really dig in prior to the disaster. We make a plan to reach out to those communities, to go in, to do training, to bring them into our network, to onboard them with some of our online tools, and start to plan ahead of time so that when disaster does strike, we have those relationships and we know where we're going to go and who we're going to reach out to. I love what Steve's doing because right now we're focusing a lot on our online tools, and it's pretty ironic that for many, many years, we were pushing everybody to get on our virtual emergency operations center, to take our online training. And, it was really like pulling teeth. It's like, please take an online training. It's not that bad. And
now they have to.
There
you go.
We were prepped, and we also work with a demographic that's not that tech savvy. So in really getting in there and getting them at least accustomed to it or thinking about it, now I think we're a little bit ahead of the curve. So for Census, for us, is really a tool that we use in pre-planning and working and designating communities we'll work with. Excellent.
Yeah, that's great. I mean, as you said, 80% is preparedness. So you really need to know what's going to go on to prepare adequately type of stuff. So yeah, I appreciate that. I kind of want to touch on something that the presentation had brought up, and it seems intuitive that an undercount, and this is for both of you, so whoever wants to jump in may. Piggyback, whatever is it seems intuitive that an undercount of our communities would be pretty detrimental, because then of course we wouldn't have those supplies that are necessary for everyone. But could you speak a little bit more about an overestimate, try and overcorrect, why that might be. Like I said, we touched upon it a bit, but you guys work, within the weeds. So you can kind of explain a little bit more as to why that's also not a good thing to do. Yeah, go for it.
So it's important to get an accurate count because resource deployment it relies on that accurate data. And if you have somewhere where it's overcounted, and let's say somewhere where that's undercounted, that means we are not being effective. We're not using our resources effectively. And that could have a bad effect for those that need it. It also means that we're not being efficient in the places that do have it. So it's really about accurately and scientifically being able to deal with issues and disasters and other things that are going on. So it's important to have an accurate count in the census.
Awesome. Thank you.
I agree with Steve. I think that being undercounted.
Makes two of us.
Yeah, I think that, yes, it's about, ironically enough, equality, right? And really, the beautiful thing is that if what we see in disaster response is truly the goodness of people coming out and sharing their resources, we see that time and time again. So we're lucky that if there is an inaccurate count, we can count on those that do have to help others. But it is about accuracy and being equitable and knowing where resources are needed. So I would say more so than anything, I agree with Steve. We need realistic numbers, and of course, preparedness. The more that we can do in advance, the more we can make those relationships in advance. I'm going to hit you up, Steve, for some technology support.
There you go.
The more that we can do that, the better off we are.
Awesome. Well, yeah, that's a very important point. I mean, it seems to come down to a sense of accuracy and just there. So, okay, I have to cut this short. We could talk all day, but we do have a lot more to get to, and we want to make sure everyone gets to speak. So again, I want to thank our guest, Steve Lawton, from the president of the Communications Organization, and of course, Lisa Arlo, the founder of World Care Center. So we very much appreciate you guys taking the time. Stay safe out there, please, and help us keep spreading this word because we really want to make sure the accurate count's there. Okay?
Thanks, Matt.
Thank you, guys.
Steve.
Okay, so for now, we are going to turn it over to a colleague of mine, and that colleague is Nicole, and she's going to talk a little bit more about the census, but now in terms of something that we're all a little bit more familiar with, and that is COVID and healthcare and the current situation that's going on and how the census relates to that. So Nicole, I think you just jumped on. Is that true?
Yes.
Yes, there we go. Perfect. I see you're about to share the screen.
Yep.
Yep, and we're presenting. Okay, awesome. Thank you, Nicole. Take it away.
All right. Thank you, Matt. And also thank you to Lisa and Steve for that great discussion. So now moving forward, we're going to be talking about COVID-19 and healthcare and how census data is used to help with recovery efforts. So before we begin, we all know this is a very challenging time. For the past couple of months, we've had to deal with the COVID-19 outbreak, and we really encourage everyone with any questions or concerns to call 311 or visit nyc.gov/COVID. And today we're going to be speaking about the 2020 census and how it'll be helping with the relief efforts moving forward and how census data is essential for our first responders combating the COVID-19 outbreak. So I'd like to start off with a short question of just think to yourselves, what healthcare programs do you rely on every day? And also, what do your family rely on, or friends, or even some resources, public resources that you have used in the past or promoted to people as well? So some of those that are funded with the census include Social Security, Medicaid and Medicare, WIC and CHIP. Also funding is set aside for reproductive health services like the Title X family grants and drug pricing programs and social services block grants. And that is really determined on the $675 billion that of federal funding that will be spread to these agencies every year. And that's based on the census. So COVID-19 as of recently, has infected 203,000 New Yorkers and caused approximately 16,410 deaths. And our hearts do go out to those that were affected by coronavirus. And the current tactics being utilized right now, as we see on the news, are testing and antibody detection, quarantine and social distancing. I'm sure many of you are working remotely from home if you have the chance, which is great. Limit of travel, closing of schools and non-essential businesses, bans of public gathering, and increased hygiene practices. And we do want to send a special thanks to all of our first responders who are working on the front line fighting this pandemic. So resources and COVID-19, as we see on the media, New York City hospitals are severely overcrowded due to this pandemic. And I'm sure if you've gone to the supermarket during this time, cleaning supplies are limited and food shortages. Medical supplies are also limited for the public and for doctors working in hospitals, such as masks and ventilators. And ventilators are actually being borrowed from some smaller hospitals in New Jersey and other states. And there's also been a lot of makeshift hospital tents being set up in parking lots and on lawns of New York City hospitals to kind of deal and cope with those overcrowding and lack of hospital beds, and also as testing centers. So now we need to start thinking about how the census can help improve these issues. So how census data is used in a pandemic response. We need to think about the age demographic. Who is our vulnerable population? Seniors and children, of course, but those with underlying health conditions as well. So that would be the immunocompromised, or also people who have diabetes or heart problems. And we need to make sure that these people have ventilators if they do, come infected with COVID-19. Then we have language. Language support and translators is crucial in any hospital setting. It's legally you must translate all medical information into the patient's preferred language, whether that be English, Spanish, Chinese, and several more. And we also need to have those first responders that are able to go out into the community past the hospital walls, that are able to educate those in the communities in their preferred language. So we need to know where those language speakers are. Maps for quarantine and social distancing, first responder routes, and pop-up centers. We need to create clear routes for first responders to be able to go into communities and set up testing sites or allocate resources out to the community. We also need an accurate population count, and that includes the amount of resources, the hospital beds, the medical supplies, and the testing needs. So we need to know who is in this community, how many people are there, and how we can start gaining those resources and setting aside the proper amount of masks and the proper amount of ventilators, the proper amount of tests, and much more. So now I would like to bring on Christine Holly, the Director of Northwell Health. I'm gonna stop screen sharing here so she can come on. Christine, are you there?
Okay. Yes, I'm here. Chris Holly's here. Do you see me?
I cannot see you.
Okay.
Give me 1 second. Okay, yes, now I see you. Hi, how are you?
Okay. I'm doing well, thank you. And my title is Director Community Outreach. Our big chief is Michael Dowling, so I just want to make sure that we give him his due.
Yes, I'm sorry about that. Well, thank you for joining us.
Yes.
And I guess we'll jump right into this little Q&A session. I guess we'll start with, how does the healthcare system utilize census data?
That $675 billion that is federally allocated is used to do programming at the hospital. It's used to take care of people who are on Medicaid. It's used to take care of seniors and Medicare. It's used to take care of children. It's used to do family planning. grants. It's used to do training. It's used to, in a situation like this, to take care of everyone in this COVID pandemic that we are experiencing. So part of what has to happen is that we have to find a treatment. We have to find vaccines. We have to do testing. We have to provide equipment for those who are doing the testing. We have to provide protective equipment for those in the testing. We have to provide medical equipment for those who are sick. You mentioned the ventilators and the IVs and you know, things that are very, very, well, healthcare is never simple, but you have grown accustomed to certain expectations. You expect to bring your family friend to the hospital and you expect to travel with them. But because of COVID, that's now a standard operating procedure. You have to say goodbye to them at the door so that you can protect them and that you can be protected and that those who are trying to take care of the people who are in dire need can be protected. And so therefore, all the mental trauma that you're getting as a provider, all the mental trauma that you're getting as a family member, all the mental trauma that you're getting from as a patient. So there's so, you know, many things that, you know, you sort of took for granted from, you know, having enough gloves or having enough gowns or having enough masks or ventilators, things we took for granted that you have to plan. And that's what the census does. It forces us to plan. And one of the challenges that we face is that, you know, how can you plan for something that you can't see? And that reminds you like of the COVID. How can you plan for it when you can't see? But how can you plan to take care of the people who you want to take care of if you can't see them? And if they are uncomfortable coming forward saying, hey, I exist, then, you know, then that's one of the things that we have done throughout our time is trying to establish collaborative relationships, trying to establish trusting relationships. So before we can take care of them, we have to make sure that people are counted. So that's one of the things that we are trying to do. And we have to advocate for the funding that we need. You know, our governor is always pointing out that New York is putting more in the coffers than it's receiving. Yeah. And we want our fair share, but we cannot get our fair share unless we collaborate with our partners and our communities and have them come, hey, we have to be counted. Every last one of us have to be counted so that we can take care of those most vulnerable populations.
Yeah, and that brings me into my next point, my next question for you. In the 2010 census, we saw that New York City was undercounted. And how is this affecting, you know, your profession just in healthcare relating to this current pandemic? And as we see the shortages and things like that, how is the healthcare system kind of coping with that undercount from 2010?
Well, we are coping the best we can. We are trying to make sure that we have a loud voice, trying to identify and show that this, you know, someone who comes in every day to take care of a person in need shouldn't have to worry about if they have enough equipment, if they have enough protective equipment to take care of themselves. And so the community and the vendors and everybody has been really, really fantastic. New Yorkers have been fantastic, trying to make sure that, you know, the hairdressers, I have some gloves, or the stores, the vendors, the supermarket, the restaurants. Oh, I have some food. Can we help to feed them? The grants, the different people with grants saying, hey, I'll do a food pantry grant. I'll do a transportation grant. I'll do whatever. So the thing that we have learned and are learning with this is that we're trying to take care of each other. But we are also saying part of our responsibility is to get the word out about the census. Okay, so with all of this testing and that Northwell has undertaken with the state being an arm to have people tested, so that we've talked about reminding people, hey, why did you do your census? So anytime we have an opportunity to say, remember the census, if there's an opportunity, if the situation is not too stressful for them, or maybe you can take their mind off something else, just fill out the census if you haven't. And if you had, tell a friend. So we are trying to
message.
yeah, we're trying to do that. But we did not have all the supplies we needed. And we can never, if we were counted and we had a bigger share of those healthcare dollars, if we had a bigger share of those social determinant of health dollars, because we're finding out that those social determinants of health have only highlighted or only magnified the negative outcomes for the people. So, if you had if you were in the undercounted, if you were in the elderly category, if you were in the baby category, you had to already worry. But African Americans were already in a negative situation when it came to health outcomes, and COVID only compounded that situation. Yes. So we did not have all the resources that we needed. And we did have to depend on the kindness of, like you say, smaller hospitals or strangers or different countries saying, hey, I want you to have, I want you to be better able to address those people you're trying to take care of. So we were not.
It's a great point. We need everyone to be counted so that those resources are there for us in the future as well. And in your opinion, how would an undercounted 2020 census then affect relief efforts and accurate relief efforts towards COVID-19 moving forward?
If 2010, if this is what we see because of an undercount in 2010, you would not really want to imagine the negative outcomes of what a 2020 undercount can do. And with all the situations that are around, with people afraid to go out, with people not really, with the social distancing that is required, how can we have people go knock on the door when that's what you're saying not to do? So that's why the electronic availability of the census, however we can get the message out so that a decreased effort is required by the ground troops to get the numbers, then that's what we need to do. But we need to do whatever we can to be counted. We know that immigrant populations may be afraid to be counted. We know that with the two crises that we have in the midst of each other, then others are afraid to go out. So then we need to, even with the double pandemic that we have, we want to ask people to do your civic responsibility, do your personal responsibility, your family responsibility, your community responsibility, and fill out the census.
Yes, and I think that that's a great point to end on. And again, I want to thank you again, Christine, for sitting with us today and joining us and spreading that information, giving more light to it. Thank you.
Thank you very much.
All right, so moving forward in the presentation, I'm going to continue here, speaking a little bit more about who is affected by COVID-19. So, who is affected by COVID-19? According to ABC News, neighborhoods with the highest concentration of COVID-19 infections were more likely to have a larger share of Black and Hispanic residents than neighborhoods with low concentrations of coronavirus cases. And these are the death rates by demographic, according to the CDC. And as you can see, the Black and Hispanic communities are significantly higher than the white and Asian communities. And we need to start thinking about why that is the case. So COVID-19 and demographics. The factors that influence racial disparity in healthcare is the densely populated living areas like community housing. They usually have higher minority populations, and neighborhoods that are further away from grocery stores and medical facilities. Not having health insurance and having underlying health conditions due to lack of medical attention. There's that general distrust. Again, Christine Holly also brought that up before. There's this general distrust of healthcare systems and also of government agencies in those minority communities. And less likely to receive paid leave during quarantine. Most of these communities have a high amount of essential workers and day laborers that need to be out there on the front lines and don't have the chance to work remotely. So putting them at more high risk of contracting COVID-19. So census data and demographics, lower income communities are more high risk, and they're usually historically undercounted communities. In the 2010 census on Staten Island, the North Shore saw a 58 self-response rate, where Mid and South had a 77 self-response rate. A little bit better, but it still can be greatly improved. And by completing the census, federal funding will be set aside to address all of these issues. And billions of dollars are on the line. And since it only comes every 10 years, we need to really make it count. So the census empowers us all. And according to the CDC, addressing the needs of vulnerable populations in emergencies includes improving day-to-day life and harnessing the strengths of these groups. And shared faith and family culture institutions are common sources of social support. These institutions can empower and encourage individuals and communities in actions to prevent the spread of COVID-19. So the census really empowers us all, and by giving everyone an equal opportunity to be heard, to help these lower income minority dominated communities that are suffering from COVID-19 with limited healthcare access, we really need to complete the census. So we have that federal funding set aside to create a new hospital in those communities, more medical facilities and supermarkets and more travel routes, and make sure that they're really being heard and taken care of in a global health crisis like we see in COVID-19. So now I'd like to bring on Ahmed Butte from Asian American Federation and Yesenia Mata from La Colmena, the executive director. So Ahmed and Yesenia, are you here?
Yes.
Yes. Hi.
Hi. How are you guys? Thank you for joining us tonight.
Thank you for having me.
So I guess I'll start off by saying a question. Either of you can respond first, which whoever decides to go first. In your own words, why is it important to complete the census, and how do you encourage your community to do so?
Then you can feel free to answer.
Yeah. Well, when it comes to the Latino community, the Latino community has been greatly undercounted, and specifically when we are talking about the immigrant community. As the executive director of La Colmena, what we have been seeing to count our immigrant community, it has been very difficult. It has been very difficult because the first thing when we ask an individual to register or to get counted for the census, the first thing they ask me is, will this information be shared with ICE? So it comes to a moment there that I and the others and our staff member need to take that extra step to let them know that this information will not be shared with ICE. And with doing this and with this extra step that we need to take, it reminds us why our Latino and immigrant community has been completely undercounted, why there has been always less resources in communities like Latino and immigrant and communities of color, because there's always a barrier there, and that makes it very difficult for our community to be counted. And through that, our job is to make sure that we educate our community and let them know why it is important. And the way that we have been doing it has been through our food distributions, educating our community, again, letting them know that this information will be shared with ICE, that they are completely safe, and at the same time is helping them in a sense on how to fill out the census. So that is a way that us as La Colmena, we have been able to register our community, one, by educating them and providing them the help on how to fill out the census.
Great. Ahmed, would you like to join in on that?
Of course. So it's absolutely true. We do need to tailor our outreach to the communities that we serve. So I know from our experience at AAF, most of the community members we work with have heard that filling out the census brings more funding to their communities, and that's one of the major talking points that we have. But as organizers, we don't feel the kind of fear, distrust, or apathy blocking our path from filling out the census when we hear about those benefits other people do. Some people ask, where is the funding? Where are these benefits?
Mm-hmm.
Because they haven't seen the improvements in healthcare, schools, or infrastructure that we talk about. That it's a typical talking point. So it is understandable that some feel apathetic towards or are distrustful of government, because there are times when we feel that same energy coming back at us. It's like a cycle of apathy. Like, we feel apathetic towards government at times because we get that same response back, and we don't get the representation we need because we're not putting in the effort to be civilly engaged as a community. And if we want to break that cycle, we first need to let them know that we're here. So filling out the census and having a complete and accurate count, it's a huge bargaining chip so that we can make those demands. And when we have a complete count, it puts us in a much better position. It undeniably makes a case for us to get what we deserve, which is much more than we're getting at the moment.
So my next question for both of you would be, what are your main concerns about the undercounted communities that you serve if they aren't counted in the 2020 census?
Well, La Colmena is specifically located in the Port Richmond area. The Port Richmond area serves greatly the Latin American immigrant community, and from our end, one of the things that we tell our community is that if you do not get counted, again, this cycle is going to continue repeating itself, where we do not get the resources that we need, as it is and right now what we are seeing during COVID. Who is a community that has been left out completely of any sort of emergency relief? It has been the immigrant community. Who has been the communities that have been affected by most by COVID? It has been the brown and the Black and brown communities. Those are the communities that have been greatly impacted due to this COVID-19. And what we are seeing as well is that when it comes to the immigrant community too, when they are sick or they feel some sort of symptoms, they don't want to go to the hospital, because one of the things is that they ask, well, if I go to the hospital, will I become a public charge? That is what people are telling us. And that it goes even further, that La Colmena itself is now transitioning itself to also being providing them with healthcare advice, or just letting them know, again, educating them that it's okay for them to go to the hospital. But it goes to that step that La Colmena is just one identity, and as it is, yes, there are other a couple other organizations that serve the immigrant community, but we need more help. And what that means, I let them know, is that you need to sign the census, because that means more healthcare resources will come to our community and will provide the services that you need as well. And now when we're saying that and letting our community know, they're slowly starting to understand that, yes, I should get counted for the census, not just for me, but also for my children, but also for the entire community. But again, it goes back to us educating them and letting them know that this is why you need to fill out the census, one, to stop the cycle. And again, this cycle is never going to end until we let people know that here we are, and we do need the services, the healthcare services. There's a huge immigration population that has not been counted in the census. And the last 10 years, it was not counted, and it has grown completely here in the island. So it is important for them to get counted, and so we can get the healthcare resources we need here in the island.
Great. Ahmed?
So Asians in Staten Island, Asians are the fastest growing population group in Staten Island. Between 2000 and 2018, there was a growth of over 90%. And so this is the second census since that initial count in 2000. And we might see that the population has doubled in those 2 decades, which is huge. And it's not very easy for, a borough to be able to accommodate for those changes in its population. So there are in-language resources that haven't improved to the degree that communities have been asking for. And one of the biggest issues is that they're not homogenous communities. There's so many different religions and ethnicities and languages within that double Asian growth that we're expecting to see in the 2020 census. So we don't currently have those needs met, and as far as language resources and interpretation services go in our schools, hospitals, libraries, and government offices. And it's not just that, but we're hoping that we can secure funding for community centers and senior care, ESOL classes. There's a lot of different reasons, even directly coming from census funds related funding that we need and that are resources that will benefit our communities. Also, there's just a lack of awareness. Like I know it's very noticeable that how much some populations have grown, but also just within the broader New York City, you usually don't think of Staten Island as being the borough with the most diverse Asian communities, for example, immigrant communities, but it actually is home to the largest Sri Lankan population in New York City. So there's a lot that people, now that these changes are happening, and it's soon, like it's only a couple of decades that so much has changed. And so it's not immediately obvious to some people, but there are new populations emerging, and with that, there's a lot of changes that are required as far as providing resources goes.
Yeah, and I think that's a great point from both of you, just broadening that education out into those minority communities and making sure that they really understand, the census can only benefit them. All of your information is confidential. If any, resources can be set aside for those communities, then that's what they should be doing. And they need to get their voices heard, make sure they are accurately represented. And of course, just keeping that, trying to break that cycle, like Yesenia said. I really enjoyed that point that you made. So again, thank both of you, Ahmed and Yesenia, for coming on here today and bringing more education about the minorities community and the census. So thank you both.
Great, thanks for having us.
Thank you for having us.
Now I'd like to bring on my colleague Kayla again. She's going to be wrapping us up for tonight. And yeah, Kayla, take it away.
The video is not starting, but that's okay. Oh, there it is. All right. Okay, once again, I want to thank Ahmed and Yesenia for that wonderful discussion about COVID-19 and the census and our minority communities in Staten Island. So before we start to wrap up, I did want to debrief with everyone a little bit. I know we've been talking about some pretty heavy stuff tonight, and I just want to reiterate that the point of our presentation is not to scare you. The point is to show how our emergency planners and first responders use the Census Bureau data effectively to do their jobs. Because the reality is that we need to be prepared for the possibility of another crisis situation happening in our futures. And when it does, we do need our heroes to be prepared. And they need to be prepared with the data, resources, supplies, and knowledge. And the way we do that is filling out our census. So now I'm going to bring on our next guest speaker, Lindsay Einhorn from New York City of Emergency Management. Lindsay, are you there?
Hi, Kayla. How are you?
Hi, Lindsay. It's nice to meet you. How are you doing tonight?
Nice to meet you as well. Nice to meet you. I'm good. I'm just listening to the cheers outside my window. It sounds so lovely.
Oh,
7
great.
already.
That's awesome. Ties right into this. That's great. So,
Yeah.
could you just introduce yourself and tell us a little bit about yourself and your role, what you do?
Sure. So I'm Lindsay Einhorn. I work for New York City Emergency Management. During pre-emergency, I do emergency management exercises, which is how we assess our ability to respond to an emergency or disaster. It's how we assess to make sure that all of our plans are working the way that they should work and that the individuals who actually have to respond to an emergency or disaster know what to do. It's a training environment. In the event of an emergency, such as COVID, I'm responding as a human services coordinator. So what we do as services coordinators is we work to make sure that there's shelter, that there's food, that we meet all of the basic human needs that you need as folks who are being impacted by that disaster.
Great. That sounds like a tough job.
It has its moments, yes.
I'm sure it does. All right, so then as you're our last guest, we wanted you to kind of bring the message home for everyone. So I'm going to ask you, how does census data impact emergency planning, and how does your profession specifically utilize the census data to prepare for emergency disasters?
Sure. So I'm using census data on a nearly daily basis. In fact, about an hour ago, I put in a request for a map that's going to be using census data to help us prepare for heat events that are actually coinciding with COVID-19 or could coincide with a power outage in COVID-19. And so we're using this information to better target our resources before, during, and after emergencies. As a lot of the previous panelists mentioned, we're doing vulnerability mapping for populations. Something that you might not be aware of as well is that the census is actually surveying businesses. And so we can overlay the individual population data on top of the business data and really start to be looking at the recovery from COVID-19 and think about where are we losing a lot of our businesses and how is that going to impact individuals in those neighborhoods. We're really looking at the population data, but we're also looking at that critical infrastructure data and putting other layers of information on top of it so that we get a full picture of what's happening. And there's a lot of other data sources, but really, how do you start without that full view of the population and knowing who is impacted, who could be impacted, and what are the demographics of those individuals so that we can really serve them. And so our GIS unit is always collecting this data before disasters, and they're creating plans and tools and templates so that when that disaster hits, we're ready and we know what we're doing and how we're going to display that information to the decision makers in the city that they can make sense of it. And so that they can really create those high-level decisions and give us that leadership that we're looking for.
Great, awesome. All right, could you talk about a little bit about how demographic information specifically is used in emergency planning? Is there anything that is really pertinent in there?
Absolutely. So I'd highlight that there are 3 pieces of demographic information that we're collecting in the census. We're collecting your age, we're collecting your sex, we're also collecting if you associate with a specific race. From those pieces of information, we can really take a lot of information and apply it in a lot of different ways. One of the most important things that we know about an aging population is that there's a lot of access and functional needs issues. And so by knowing where there are pockets of aging populations, we're able to really target access and functional needs. And so that's a huge piece of information that's very helpful in a lot of the different plans that we're doing. a lot of the panelists before me mentioned language. We're using that language data on a daily basis to really make sure that we're not just doing our outreach, but that we're also responding with interpreters appropriately. So if I'm standing up a shelter in Staten Island, it's really great to know that there's a huge range in the different types of populations from Asian countries that are going to be spoken, because I need to be prepared to be able to communicate to them. How can I serve a population without communicating? It's pretty impossible. And so that language data is hugely critical. And as we know with COVID-19, there's a lot of different vulnerability factors, but one of those is age. And so knowing where those pockets of aging populations are is, again, very helpful in today's response.
Yeah, that's definitely need to know that. If you want to talk a little bit more about COVID-19, how, in regards to emergency response planning, why do you believe the census is important in regards to COVID-19?
Look, the census is not the only source of data that we have, but again, it's that piece of data that gives us the overall picture of who people are and where they are. And so without that data, it's really impossible to respond to any emergency, especially COVID-19. When we started hearing reports about how Black and Brown people are being affected at higher rates, the first thing we do is put that on a map. Let's take a look at where these populations exist. Let's make sure we're doing the outreach. Let's move the resources to where they're needed. And that's exactly what was done and continues to be done. We call this a pandemic a slow-moving disaster. It's something that's very hard to get the data and information because it's happening at a slower rate than something like a hurricane that's over in a day. And that we're able to get that information because it's no longer happening. The hurricane is over. COVID-19 is ongoing. It's going to be ongoing for what we know to be quite a long time. And so the information that we're getting on a daily basis is only giving us snapshots of what's happening. And so as we get more and more data from COVID-19, we have to respond to it because it's a changing and evolving event. It's not a static event. And so it's a challenging response, but it's why we need this data, because it really feeds into the ongoing response.
Okay. Yeah, see, that's something most people probably wouldn't have thought of, how like a hurricane is over and then you do the aftermath, versus COVID-19 response is an ongoing thing. You have the ongoing care is being provided for people, and ongoing, data, and, you guys.
As we get more information, because the response is changing just as the disaster is changing, and we have to be responsive to that.
So why don't we go back to like specifically like Sandy or any type of hurricane? Can you talk a little bit about what census data is used in when it comes to preparing for a natural disaster like Sandy, and then a little bit about the aftermath?
Sure. So the population data is critical for any sort of hurricane preparedness planning. I think I'm going to reference one of the plans that New York City probably knows the best, which is our shelter plan. And so there are probably a lot of people out there saying, I have no idea what the New York City shelter plan is. But what our shelter plan is as the Know Your Zone campaign. And the Know Your Zone campaign is on billboards all over the city, it's on buses. And this is a big piece of our shelter planning for people to understand and know where shelters are. For us to plan where the shelters go, we need the population data. And what we do is we take that population data and we assess how many individuals are not going to have a place to go that are in hurricane evacuation zones. And so that's why we're encouraging you to know your zone, but it's also why we create those zones in the first place, is because we're counting the individuals in each of the zones and making sure that we have a place for you to go. We're making sure that you have a way to get there, and we're making sure that you know how to access that information and access that resource. And that's all made possible by the census.
Thank you. Thank you so much for that.
No problem.
Wonderfully wrapped up in a bow information for everybody. So I want to thank you so much for being here. And anything else you want to say before we end?
I just want to say, I know that we've put out the website for COVID-19 information, but if you're looking for more information or information as the disaster slowly unfolds, text COVID to 692-692, and you'll be getting those updates daily on the city's response and where you can get information and support during the COVID-19 crisis.
Great, that's a great piece of information. Thank you so much, Lindsay, for coming on. And you have a great night and stay safe.
Thanks, same to you.
All right, thank you. Okay, so just before we go, I do want to wait for the screen sharing tool. There you go. Okay, so just before we go, I want to thank Lindsay for that, again, wonderful piece of wrapped up in a bow information summation of our presentation. And we do have a special message for Congressman Max Rose that I will play for you guys right now. I'm sorry, I'm getting note that you guys can't hear the video. Second.
You know, for far too long, Staten Island and South Brooklyn have been consistently ripped off and ignored when it comes to federal funding. But right now, the stakes have never been higher. And there's so much more that we can do to change the amount of federal funds coming our way. Census data informs and dictates how our government allocates more than $800 billion in federal funding every single year for schools, fire departments, hospitals, community health centers, and so many other services that have influenced and impact our lives each and every day. Think about what that means right now, especially in light of the crisis we've been facing. We've and hospital beds per capita, and ICU facilities per capita, and so much more. Well, the only way we can be sure that those metrics are meeting our actual needs is by having an accurate count in the census. And I would be remiss if I didn't mention that accurate demographic data can play out in guiding us out of our current struggles with racial injustice and inequality. Everybody agrees that we have got to make changes, policy changes, to help fix this. You know, we can't fix everything through policy, but making sure that our government, making sure that our elected officials, our legislators, and of course, yes, our police forces, our representative of the communities they serve. That's a good place to start. So thank you all so much for having me. And of course, to the UAU for leading this initiative on Staten Island. You know, we only get this chance once every 10 years. And I know for a fact, knowing so many of you, that you all are going to make it count. If there's anything that my office can do to lift up and support what you're doing, anything that I can do to support your efforts, I promise you we're going to be there. So thank you so much again. God bless you, and God bless the United States of America.
Thank you, Congressman. All right. Thank you, Congressman. And I want to thank all of our guests that were here with us tonight and imparting their wisdom on everyone. We couldn't do it without you guys. So I want to thank Lisa Orloff, Christine Hawley, Steve Lawton, Ahmed Butte, Yesenia Mata, Lindsay Einhorn, and again, Congressman Max Rose for sending us that wonderful message. And I do want to do a final thank you to our first responders during this current pandemic. And I want to draw attention to the fact that we clap at 7 p.m. every day to thank these essential workers. And the expression of thanks is great and appreciated, but there's a way to actually help them do their jobs, and that's filling out the census. Filling out the census is a tangible way to help them. They're putting their lives on the line every day to help us. We can take 10 minutes by going online and filling out the census to help them. Thank you everyone for joining us tonight. UAU has several social media platforms that you're all welcome to follow us on. We have Facebook, Instagram, Twitter, and any of these hashtags could be used to follow us as well. And once again, we want to help our first responders. We want to help our first responders and essential workers by completing the census. And that link is my2020census.gov. Go on, fill it out, take 10 minutes, you'll feel good about a productive thing you did that day. Thank you everyone for joining us. Have a great night, stay safe.